Morning, everyone. Thanks for joining me here today. Yesterday, Dr. Brent Roussin, our Education Minister, Cliff Cullen, announced that kindergarten to grade 12 schools in Winnipeg and Brandon will be moving to remote learning effective this Wednesday until May 30th. I want Manitobans to know this decision was not made at all lightly, and that keeping our schools safe and open has always been our objective. For students, for staff, for families that are visiting, this has been at the forefront of the entire COVID pandemic response planning. Keeping students in the environment in which they learn best, closer to their teachers, is the environment we would prefer that we could have them in to the greatest extent possible. The fact that we've been able, unlike many other jurisdictions in Canada, to keep our schools open for most of this pandemic is a testament to the hard work of a lot of people, our teachers, our school staff for sure, and to them I say a sincere thank you. Thanks for adjusting, adapting, taking on the challenges of this past year. In-school learning has been, I'm sure, even an additional challenge in this time of the pandemic. And then, of course, there's the remote learning challenges that have resulted in a lot of learning opportunities, I'm sure, for educators as well, but are a real challenge. Thanks for putting the safety of our students first. I think it's important to understand in the context of where we are as a province right now as well, that proactive actions taken by this government and by the people of Manitoba have allowed us to delay this third wave significantly versus most other jurisdictions, certainly outside of the Atlantic bubble. So we delayed the third wave, but we're in the third wave. So what's the challenge now? And the challenge is simple. We have to shorten that wave. And the way we shorten that wave is we follow public health orders and we get vaccinated. Nous avons retardé l'arrivée de la troisième vague au Manitoba. Maintenant, nous devons raccourcir le temps qu'il est ici. We delayed the third wave with some of the strongest public health and enforcement measures in the country of Canada. And because of Manitobans' willingness to follow those measures. It isn't just the measures, it's the willingness of Manitobans to follow them that really matters. So thank you to Manitobans for doing that and for continuing to do that. Despite these collective efforts, we're in a race between these variants and the vaccines, and more must be done to ensure that these variants don't win, which is why on Friday, Dr. Roussin and I introduced new strict public health orders to help stop the spread of the variants and reduce the strain on our healthcare system. These measures are going to be in place for a minimum of 3 weeks, May 30th, and during this time it is crucial that Manitobans stay home as much as possible, significantly limit your close contacts, and of course get that vaccine when you have the chance, as soon as you have the chance. We need the full participation of all Manitobans in order for these public health measures to work so we can bend our curve down, so we can get our lives back. And I say to Manitobans, and I remind Manitobans yet again, we've done this. We did a better job than virtually anywhere else in the country at bending that curve down. We can do this. Manitoba has a distinct advantage over many other jurisdictions in Canada and around the world. We have a concentration of population, community-minded people, a history of pulling together in the right direction to do things for ourselves and for others that is, I think, a noble aspect of Manitoba's history and a big benefit to us in the context of where we stand right now. We've done it before, and we can do it again too. And in the meantime, we're going to continue to work as a government side by side, as Manitobans do, to support their local small businesses, to help them do what they do best, to employ our kids and to help give us the services and the goods that we need. We rely on our small businesses and they rely on us. And that mutual relationship is really important, and I value it and treasure it as a former small business person myself, as a former Chamber of Commerce president. I think it's really critical that we do everything we can to support our small businesses. That's what I want to talk to you about today. On Friday, we announced the Manitoba Pandemic Sick Leave Program. That program is going to provide financial support to our Manitoba businesses, nonprofits, charitable organizations, and others to help them cover the costs that they will incur as they support their employees during this pandemic when they need to stay home because they're ill, or when they need to go and get a test, or when they need to go and get a vaccine too. That program is the strongest such program in Canada at this time, and it is designed to provide the best possible coverage, access, and supports to our small business community. And today, I'm announcing even more supports for our small business community. First of all, I think most who are watching this know that we have provided some of the most accessible, most available funding for small businesses throughout the entire pandemic, and we plan to continue to do that as is necessary. And so today I'm announcing the 4th installment of our Manitoba Bridge Grant. And this is not a loan, as many other programs across the country are designed to be repayable. Ours is a grant, meaning that the money goes out, it does not come back in the form of a repayment from a small business. A family-owned small business would not have a bill on top of all the other possible bills that we can incur during this difficult time to the provincial government. So this is our 4th such installment, $5,000 in direct financial support to all eligible businesses, nonprofits, charities to help them bridge through this 3rd wave. We anticipate that there will be more than 12,000 businesses and organizations that have storefronts that will qualify for this support. In addition, we believe close to 3,000 home-based businesses will also benefit from this program. This will result in a total amount of grants of approximately $70 million in direct financial support. I should also mention that our programs are designed so they avoid red tape. And so eligible businesses and organizations will receive that $5,000 payment this week. We know the bills keep coming. We know that we cannot, and all of us know this, cannot possibly make up for the hardships that have devastated our country, our world, as a result of this pandemic. But what we can do is offer significant financial support to help bridge through this challenging time and get you ready to do the things you want to do as we are able, through more vaccinations and through adhering to the public health rules, as we are able to reopen in the not too distant future, we all hope. We also recognize that the announcements that we have made in terms of additional restrictions, in particular the announcement late last week, was done out of a sense of urgency without a lot of advance notice being able to be given to some businesses. And so for that, I'm not going to apologize. I'm going to say we had to act. We chose to act. We believe we did the right thing, but we also recognize that there was an impact on the operations of particularly the restaurant industry. And a belated, if I can, a belated Happy Mother's Day to everyone, but I know that some of you were looking forward to a dinner out with your close family, and that couldn't happen. And so the restaurant industry had to gear up for that possibility. It's one of their bigger days. And so because of that, today I'm announcing that bridge grant of $5,000 for restaurants won't be $5,000. It will be $7,000. And that additional $2,000 is our way of saying thank you to our restaurants for the important services they offer and want to offer. And we want to get back to your restaurants as soon as we can, too. 1,800 restaurants will benefit from that assistance, so that's another $3.6 million that will be going directly to our restaurants across the province. Additionally, we are announcing today, on top of our previous program for dine-in restaurant relief, which was a $7 million program, today I'm announcing an additional $2 million will be going into that program to bring it up to a total of $9 million. And this is to help our restaurants transition to a delivery model. This program was first announced in late last year in December, and it's a partnership And I thank the Manitoba Chambers of Commerce and the Manitoba Restaurant and Food Services Association for their input, their advice, their decisions in terms of how this rebate program would be administered. It was designed and continues to be designed as a rebate program to help offset any additional costs related to food delivery services, whether a restaurant provides its own delivery service or it uses a third-party delivery company. We urge Manitobans to stay home as much as possible over the next few weeks. We also, at the same time, know that Manitobans need to shop and for necessities, and we encourage Manitobans to support all the businesses, the small businesses in particular, across our province right now by ordering takeout, delivery, or curbside pickup. Our government remains committed to delivering the right programs at the right time, and we've been endeavoring to focus on helping individual Manitobans and businesses get through these challenging times. We continue to expand upon what were already some of the most generous support programs per capita in the country. Our programs are broad-based, they're designed to be easily accessible, and they provide direct financial support where and when it is needed. In Budget 2021, Protecting Manitobans and Advancing Manitoba, we provided over $1 billion for this year alone for anticipated COVID-19 response, and that includes $300 million in contingency funds for future needs, such as the business supports that I'm pleased to announce today. Your government's been there every step of the way. We're going to keep doing so. We will not rest until COVID's put to rest. Votre gouvernement a été présent à chaque étape. Nous continuerons de le faire. Nous ne nous reposerons pas tant que COVID ne sera pas vaincu. We have a few tough weeks ahead of us, but we're together in this. And as we unite around the challenges we must face together, we will succeed. Right now, we're in a race between variants and vaccines. You can do your part to help us win that race by getting your vaccine as soon as possible, and I encourage you to do that. The best vaccine is the first one available. There seems to have been some confusion about that last week. I want to clear that confusion up. The best vaccine is the first one available. Our vaccine team is working really, really hard to make those vaccines available to you, to expedite that process and make it as effective as possible for you. New sites are opening, new access points, pop-up clinics, rapid access teams, distribution mechanisms are being used that will make the process easier for you to access. The team is working very, very hard, and I say thank you to them, and I know Manitobans want to say thank you to this team as well. It's 2,000 people that are working very, very hard to get those vaccines out to you. You need to do your part by getting that vaccine into you. And so I encourage you to do that. To make an appointment, go to protectmb.ca. We all have a role to play. And your role may be just protecting yourself and your loved ones in your community. That's an important role. Please fulfill that role by getting a vaccine. Level of caution needs to remain high. Stick to the fundamentals. Keep playing defense. We'll get through this together. I welcome your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CJOB, Skylar.
Hi, Premier. Thanks for your time again this morning. You mentioned in your opening remarks that you and Dr. Roussin delivered Manitoba's public health orders on Friday. I just find that a little bit misleading because Dr. Roussin was the only one available at 6 p.m. And I think, as a lot of folks know, that came after a long day in court talking about public health orders. So I'm just wondering why the decision was made to not have you present. I understand you did make an announcement earlier in the day, but it certainly seems like your presence would have been appreciated on Friday and then again yesterday with the school announcement.
Yeah, well, I've been available over 125 times to the media since this pandemic started. I think maybe on health measures, the most important thing is that we get them out there and that people follow them. And if you think that people will follow them more readily if I'm at the announcement, then I'm happy to be there. But I think Dr. Rusin delivering that and me being responsible and accountable for the decision is a good way to go too. So, you know, we have our education minister making announcements on education. I'm happy to make announcements all the time. If you want, I'm available every week. So I'm happy to take your questions. What's your next question?
Thank you for that. My next question is just about sector-specific business support. Will there be any more coming to any more industries? I know the hospitality industry also had its own little batch of funding in March. I'm thinking of fitness centers in particular. They seem to be affected by shutdowns generally around the same time as restaurants, but they haven't received any sector-specific funding yet. Is any more on the way now that we're into another round of shutdowns?
Well, we've demonstrated, I think, our openness to looking at supports where needed, and we've worked with the business associations, the organizations from the get-go. So I won't dismiss it or take it off the table. We know that definitely some of the hardest hit industries that we encountered, we designed programs for them. So yeah, I wouldn't rule everything out. We've been pretty much ruling more programs in than out.
From the Winnipeg Sun, Josh.
Good morning, Premier. Josh Aldridge, Winnipeg Sun. Should we be expecting that we'll get any kind of a breakdown on cases in different sectors? For example, like restaurants to be shut down with the reduced capacities already in place. A lot of them were basically empty as it was. So I think a lot are frustrated by that. Should we expect any kind of breakdown on these types of cases or modeling for how these restrictions will impact cases going forward so that we can make better decisions and so we can gauge where we are in terms of potentially getting out of this a little better?
Yeah, I've heard the opposition calling for more modeling. I understand that the public health officials have released modeling on a fairly regular basis, but you can always call for more modeling, I suppose. The key point is, if we're going to get out of this, we have to get vaccinated, and we have to observe the public health rules and respect them. Every time somebody runs a criticism, whether it's the opposition political parties or a columnist about public health officials on the public health orders, I think that works counter to a degree to people being likely to respect the rules and follow them. So I think it's counterproductive. I think it's time for everybody to get on Team Manitoba. That doesn't mean you can't ask questions. Of course you can. That's why I'm here, take them. But I do think it's really critical that we get vaccinated. And I think that the more people that do that, the better. And I also think it's really critical that those people that are ignoring the public health orders wake up and stop doing that, because that's making it worse for everybody else.
I was wondering, why was there the need for a delay in announcing the school closures between Friday and Sunday? Why couldn't those announcements be made on Friday to give teachers that time to plan, to give parents that opportunity to plan? Why was there that need for an extra 36, 48 hours to actually make that decision? Should those decisions not have been already kind of set up in a plan or made previously? Why the delay in that announcement?
Well, I think you're talking about a school closure doesn't occur till Wednesday, right? So I think as a teacher, you've given me 3 days to prepare. That's not bad. I think that our teaching profession understands the challenges very well. They faced up to them in the past. These decisions aren't made lightly. They're deliberated upon, and when deliberated upon and made, they're announced, and then time is given to act. And that's exactly how this decision was made, and exactly how it's going to be rolled out. It's a tough decision. Needed to be made. Right thing to do. Did it. Now, get a vaccine and abide by the public health rules.
From CBC Manitoba, Bart.
Morning, Mr. Premier. What form of help or support will be offered to people who, starting on Wednesday, won't be able to go to work because their kids are home?
Yeah, there's a wide array of programs. I don't know of anyone that's designed specifically, whether provincially in any province or federally, to cover that, Bart. But I think I gave short shrift to your question the other day, so I'm going to use this editorial opportunity to try to address the issue you raised about shouldn't you have done things sooner, because I think it's a real fair question, and I didn't think I answered it very well. We acted, as you know, several weeks ago to introduce new restrictions when we had about 100 cases in the province. And our restrictions were already more limited than in most other provinces at that time. And we added to that, as you know, by reducing the household gathering numbers. I don't need to go through the restrictions, you know that. Then again, when we went to about 200 cases on April 26th, we added further restrictions, reducing our opening numbers, percentages, banned visitors to private households to much consternation, and but we felt that was the right thing to do. It could be argued we should have closed everything down back when we had 100 cases, and I don't think that would have been the right thing to do, because it ignores the reality that we have to have people follow the public health orders in order for them to work. It isn't just the orders themselves. Our restrictions have been significantly more than most other jurisdictions across the country. Saskatchewan has never reduced retail below 50%. BC's never reduced retail except to social distancing, and we have retail reductions that have gone from 50 to 33 to 25% and now 10. So on retail, on public gatherings, on household gatherings, our restrictions are and have been stronger, frankly, than anybody else. So I'm trying to answer the question the other day and do it justice, because I didn't think I did. I hope that information is somewhat helpful.
It is somewhat helpful, and thank you for that. But on that note, would you commit in the future, should cases ever rise again on an exponential basis, to lock down early and show the public via modeling, which does advanced modeling is not released, show the public what would happen if that doesn't happen? And the reason I say that, and forgive the long-winded preamble, is in the jurisdictions that have locked down early quickly, they have said, okay, this is what's going to happen potentially if we don't. So would you, moving forward then, commit to an earlier lockdown should we ever have a precipitous fourth wave?
Yeah, and it's a good question, Bartley, and thank you for asking it. I've been a proponent of more information, not less, from the start of this pandemic, but I also want to offer support and encouragement to our public health officials when they feel there's a right time to release information or a wrong time. They communicate that, and I accept the responsibility for those decisions. To be fair, and I think this is important to remember, I'm not trying to be a cheerleader. I'm trying to tell Manitobans the facts here. The fact is, Manitobans have bent the curve. They have done this better than anybody outside, perhaps, of New Brunswick. New Brunswick didn't really bend their curve because it was never very high. I'm going to stick to the story here. Manitobans have bent the curve down better than anybody else. Year to date, outside of the maritime bubble, we have in Manitoba, at minimum, 10,000 fewer cases than any other province. Like Saskatchewan's the closest to us, and they have 10,000 more cases than we do. And let's be clear here, their restrictions aren't as strong as ours in most categories. So it's not just the restrictions, it is about people's willingness to follow those restrictions. And so I take your question as a very valid one, that the more we can convince people with honest data, whether predictive, or as I'm doing here, I'm giving you historical facts to make the case that we have acted. We have acted in advance of situations, not waiting for them to happen, as some have accused us of. I think that's helpful. So I think I support your questions. I support the idea of getting more information to people, not less.
From the Canadian Press, Kelly.
Hi, Kelly from the Canadian Press.
Hi, Kelly.
So some businesses and specific industries have called for more support from the Manitoba Bridge Grant. What lessons did you take away from the application of the grant during the second wave, and why not do more then for the businesses that fell through the gaps then, now that we're facing a third wave?
Well, there's going to be, I don't know about the falling through the gaps assertion, Kelly. I think that there are federal programs designed to cover, for example, significant wage expenditures through the federal wage supports, overhead costs for rents, for lease costs, things like that, that we're trying not to duplicate those programs. We don't have the fiscal capacity. No province does. Even Ontario doesn't, to fill those gaps you're referring to entirely. What our programs are designed to do is to give base support, which clearly will help smaller businesses, perhaps more than larger ones, because their needs are greater in many cases. But our federal programs don't generally have that as their goal. So with our programs, we're trying to get funds. Now this is our fourth bridge grant. That's $20,000 in total. Not a loan, as many programs do take the form of a repayable loan, rather a grant, meaning no money coming back to the province. Also, we preceded that, as you may remember, and this is now many months ago, with a thing called the GAP program, which was an additional $6,000, also a grant, so $26,000 there. Plus, we had wage support programs. We will be very likely looking at those when it is appropriate to start expanding back in our economy, and youth support programs to the tune of tens and tens of millions of dollars to our small businesses to use to offset the costs of employing young people, to help drive down our unemployment rate for young people. We've also offered targeted industrial support in the key industries of hospitality and restaurant sectors, as well as outfitters and lodges and others. So these programs, taken as one, are compared against any other province, stand very, very well as a measure of the support this government wants to give to small businesses.
And you spoke about this a bit when you were responding to Bart's questions, but while Manitobans were hearing that restrictions were being tightened and schools being closed over the weekend, our neighbors just to the west in Saskatchewan were hearing about the first steps of their reopening plan. So what can you tell Manitobans about why this situation is so starkly different?
Well, it's not starkly different. It's just they got the pandemic a lot sooner than us, so they got the third wave, and they got 10,000, 12,000 more cases than we did, and we are now in the heat of the third wave when everybody else got it earlier. We're still in the middle of that third wave, and I don't think anybody should stop playing defense. What I liked about Saskatchewan's proposition or their proposal was forward-looking. I like that, and we have a project that's been underway for some time that we're going to be releasing to the public to put some hope in the window too. That being said, we have to remember that our number one challenge right now is to play defense in the middle of this third wave. And that challenge remains in other parts of the country, and it's going to remain in Saskatchewan, Alberta, BC, Nova Scotia, Ontario, Quebec, and everywhere else for the next foreseeable while, because we don't have enough vaccines to solve this problem in the short term. So it's going to be an ongoing challenge. So I like the idea of the forward thinking. I think that's what may help motivate people to follow the public health orders. If they can see some way out of this pickle that we're all in, then I think more and more people are going to be inclined to be patient than would be the case otherwise.
From CTV Winnipeg, Jeff.
Oh, hi, Mr. Premier. Jeff Keel, CTV Winnipeg. Just going back to what you just said and how you answered one of Bart's questions. Seeing what happened in other provinces, and the fact that as we've said in this province, we've delayed the third wave. Do you regret not putting in these public health restrictions and the compensation for businesses 3 weeks ago, so we wouldn't be where we are today, where a lot of us who are not doctors or scientists, even the layman, predicted we would be here? So do you regret not doing it 3 weeks ago?
The problem with that is two things, Jeff. One, we maintained some of the toughest restrictions in Canada while others relaxed. We limited retail, we limited gatherings. We maintained those, others let them go. BC opened up their retail entirely. We did not. Alberta, Saskatchewan, Ontario opened up far beyond us. So two things. One, we already had some of the toughest restrictions. Two, we began stiffening them up when we had 100 cases. Now, to suggest that we should shut down our economy when we have 100 cases is to suggest the only way to avoid a lockdown is to have a lockdown. And that isn't right. That wouldn't be fair. What about the 100,000 people you put out of work when you do that? What about them? What about the mental health and well-being of families and individuals across the province? So we've acted 3 weeks, more than 3 weeks ago, with measures to begin to reduce capacity for gatherings, retail, and so on and so forth, when we had 100 cases. We acted again 2 weeks ago, went further, reduced the amount of people that could get together. We eliminated gatherings. We reduced public gathering sizes and a variety of other measures. We did this when we had 200 cases. To suggest that we should have done all that a month ago when we had 100 cases is to suggest that somehow a lockdown is the best way to prevent a lockdown. I don't buy that logic. So we have a challenge in front of us now. That challenge is to work together to get vaccinated and to follow the public health orders. We do those two things. We have already bent the curve before, and I believe we can bend the curve again. Not going to be easy. It wasn't easy the last time, but it's worth it. And when we get more and more people vaccinated, the chances of COVID coming back are reduced. We need to have more people getting vaccinated. With every passing day that's happening, I see the vaccine team is now planning within 10 days to get it wide open. We're down to 35-year-olds now. That's good news. But we need people to step up and get their vaccines as soon as possible, obviously. The sooner that we do that, the sooner we can get our lives back.
Just comparing to the second wave, I went back and checked this before the news conference today. It was almost 3 months, I believe, until we could actually start laxing restrictions. Right now, these orders are in place for 3 weeks. That includes schools. I mean, what are the odds any of this could be laxed by June, because our case numbers are so high and growing? Should parents just prepare for the worst case scenario that, kids aren't going back to school this year, and a lot of businesses, might not open for the foreseeable future beyond 3 weeks? Because if, looking back at the second wave, it took a long time to come out of that. Yes, we bent the curve, but it took a long time.
It's a different time, though, Jeff, and we're different people. And we didn't have vaccines in the second wave, not to any degree. We've got more than 565,000 as of May 9th vaccinated right now. The future's in our hands. Look, Manitobans can pull together. We've done it before. We bent that wave before, and that was without a lot of vaccinations being done. Now the awareness is higher. The vaccination numbers are going up. We've got more than 44% of Manitobans 18 plus, more than 90% of our age 70 plus. Our death rates have gone down markedly. As I said, we've done more as a province than any other province outside of the Atlantic bubble to keep COVID down. So we suppressed it, but it's here now. And now that it's here, we have to follow the public health orders. We should have been doing that all along. Some people forgot that. They got to remember it now. That's why we increased the enforcement, the fines, took those measures again, stepped those measures up actually on 2 different occasions in the last month to frankly provide a deterrent to folks who would risk the health and well-being of not only the economy of our province or risk our healthcare system, but risk their own health and well-being and that of their friends and family. So these measures have been taken clearly with a view to trying to shorten the period that we're going to have to endure this third wave. We're not powerless in this. If the rate at which Manitobans gets vaccinated has an impact on the ability of our province to reopen, and the willingness of our public health officials to say, go ahead, you can start to get your lives back. So we're not powerless in this. Follow the health orders, get vaccinated, we can shorten this third wave. That's the goal.
From City News, Mike.
Yeah, good morning, Premier. Mike Albanese from City News. My question's already been answered, so I'll switch gears a little here. Is there any preliminary enforcement numbers that we can know of as of Sunday morning to now?
Tomorrow should have those for you, Mike. Sorry, I don't have anything to tell you. As you know, we stepped up enforcement. I would hope to see that I would hope that everybody abided by the public health rules and there are no tickets, but that we'll tell you tomorrow. We'll see what the results are tomorrow.
Thanks, that's understandable. Speaking on enforcement, though, when you said that you could revoke licenses or garnish wages, how easily can that province do that? Is that something that people can actually expect does happen in the near future?
Yeah, those powers exist already. They're there for your unpaid tickets, fines at various levels. Those are not new rules. They're just, what I'm attempting to do is let Manitobans know we're serious about enforcement because although there have been some reports to the contrary, we are. So I can only tell you that, I would hope that we can deter people from making the wrong decisions in respect of gathering maskless and doing the kinds of things that don't help to battle COVID. Let's all get on Team Manitoba now. And Team Manitoba needs to help each other get their lives back.
From CHVN, Taylor.
Hi, good morning. In yesterday's press conference today in communication with the province and your response to Bart's first question, it sounds like there aren't any provincial plans for finance supports for parents or caregivers who will have to take time off work to stay at home with their kids. If school-aged children are discouraged from attending childcare when their school is remote learning, what should working parents or caregivers do?
Well, I was referring to the provincial program. There's a specific federal caregiver program, if that's what you're referring to, that is available for application that people can use. So I wouldn't want it to be misunderstood. The caregiver program is there if you need to do the things you just outlined.
And, of course, not all parents will be able to stay home. How is the province addressing a lack of accessible childcare during these closures?
Well, actually, we've got available spaces. We've been proactive in this. We've created literally hundreds and hundreds of additional spaces. So the space issue is one that we think we can address. The issues of safety, and again, thanks to our care workers as well and the child care centers, they're, I think, doing a bang-up job, and we need them to do that. In particular, we've accommodated the need in the schools as well for those who are in, frontline caregiving positions that need child care to be able to have their children continue to attend school as well, as the Minister announced yesterday. So we're thinking of those folks, and we need to get through this together, and they're a key part of helping us do that.
From the Winnipeg Free Press, Timor.
Good morning, Premier Pallister. This is Timor Durrani with the Winnipeg Free Press. Thank you for taking the time today. Premier, Manitobans did not get a clear answer on this yesterday or Friday. And while you mentioned you won't apologize for this today, these restrictions are a flip-flop from your previous line only a week ago about least restrictive measures for businesses, storefronts, and even schools, because your government had told Manitoba that something like this would not happen since COVID-19 cases were not coming from those places. So what changed so quickly within a span of days that caused this surge? Have people suddenly stopped listening to these restrictions? And why are you not apologetic for the people you promised would not get these restrictions until contact tracing or modeling data showed it was needed, which your government has yet to show them or us?
Well, you touched on a number of topics there. I can only say I'm not apologetic for making difficult decisions. I'll continue to do that.
Thank you, Premier. My second question is, you mentioned just now the workers out of work when restrictions are announced. What exactly is your government doing to provide them with support? Employers are hesitant to lay off workers again, so many of them have been reduced to part-time hours with these new restrictions. Are the federal grants the only place they can turn to right now, which do not offer much support either?
We continue to offer the most generous program supports of any provincial government. We just announced our sick leave program, which is the strongest in the country, and we continue to offer supports where needed whenever possible.
From Global News, Joe.
Good morning, Mr. Premier. On the restaurants, one argument I've heard for restaurants is that they've been either closed or following strict rules when spikes occurred in the province, meaning they feel they can't be responsible for the rising cases. And most recently, for indoor dining at least, they were only serving people from the same household. So I guess why completely shut down restaurants again?
Yeah. Well, I get this, Joe. Industry groups naturally don't think their industry is the problem, and I know how hard small businesses have been working, and industry groups have been working with them to help equip them to do the best possible job of defending against COVID. I also know that what the healthcare officials are after is reduced contacts, and the way we get increased contacts is increased social activity, which we all long for and would love to not have to sacrifice in the name of fighting COVID. I understand all these things. I also understand, as do most restaurant owners, that the sooner we can get through this, if we can shorten this third wave, the better for everybody in the industry, in the population. The sooner I can get to a restaurant with my family and friends, the happier I'm going to be. And so I encourage people in the interim period, do curbside pickup, do delivery, support the restaurant industry as best you can. But our public health officials are saying reducing contacts is the way we beat COVID. So let's beat COVID together.
Thank you. And I just following up on one of your previous answers about Saskatchewan's roadmap to reopening. If I heard correctly, we can expect a similar reopening roadmap soon, and if so, when?
Yeah, in the not too distant future, there's a couple of different programs we're researching and working on right now that I think are valid to get out there. But I would say this again, and not too distant future, a couple of weeks, I think, to answer your question. But I would re-emphasize that the critical battle in front of us is that we get everybody we can vaccinated. And I encourage all Manitobans to get vaccinated at their first opportunity. We're seeing vaccine reluctance in some quarters already. We know from other jurisdictions that are far ahead of us in terms of vaccine availability, such as the United States, that as Governor Burgum from North Dakota said, they went from a lineup to get vaccinated to having, within a few days, to have to convince people to come in and get vaccinated. If we can avoid that long, drawn-out tail or trail of folks wanting to come in gradually over a long period of time to get vaccinated, that's a good thing to avoid, because we need, as Dr. Tam has said, to get herd immunity. She's referencing, I think, 75% minimum, more like 80% on first vax, significant numbers of second vaccination to get us to a position of greater safety. The sooner we can get to that, clearly the better, not just for restaurants and movie theaters, but for all of us.
Our final reporter this morning, Mr. Premier, from the Brandon Sun, Drew.
Thank you. Mr. Premier, this is the fourth extension of the Manitoba Bridge Grant program, and the basic level is still $5,000 as it was back in November. So why not boost that as businesses keep having to shut down and the financial harm from the shutdowns grow?
Well, you can make the converse argument it should have been higher earlier when we weren't used to it, when we were adapting and we were in a brand new challenging phase, Drew. It's $26,000 of unencumbered grant money to every business in Manitoba that's chosen to apply. I can only tell you that no other province is doing to this degree, with this degree of simplicity and accessibility, the kind of supports we're doing here in Manitoba. And I say again, it's not going to make up for the hardship. I know everybody would rather we didn't have a COVID pandemic, but we have one, and we have to make the necessary decisions as best we can to try to help each other through it. These announcements today, are our desire to help our small business community get through it.
Okay, thank you. And just as a follow-up, you said a couple times today that the way out of this to help with lockdowns is to get vaccinated. So I'm wondering, is there a percentage of Manitobans who need to get vaccinated to lift the lockdown, or a milestone you're looking for before things can be eased?
Yeah, well, that's what I'd like to see as part of the picture that we give to Manitobans so they can understand what the incentive is here. What's the United Way thermometer look like? What are we supposed to be shooting for here as a group? I want to see that as part of that predictive thing, because when you put that in the window, and several reporters have asked questions along this line today, which is central to what I believe we need to do, which is to help Manitobans understand what it is we need to do to get where we need to go, and where is it along that line that we can have dinner with our mom. Where is it along that line that we can have a couple over to our yard? Where is it along that line that we can get together with a group of friends? We need to show Manitobans that picture, because that's how we'll motivate Manitobans to get their vaccinations. And that's how we'll create a sense of hope that where people need it. So we've done better than everybody until recent days. Now we need to do better than everybody in getting through these days to come. It's not going to be easy. Manitobans aren't up for easy things, they're up for challenges, and we're up for this one too. We've done it before, we did it in tougher times. Now we have a chance to do it when we have a vaccine available. And that's a great opportunity for us to show what we're about here in Manitoba. So go Team Manitoba, go get your vaccination and follow those public health rules, and we'll get through this thing together. Thanks, everybody.